Good afternoon, everybody. I am Dr. M.A. Muqsith Quadri, consultant physician and diabetologist working at Kamineni Hospital's King Koti. Today, we're going to discuss about diabetes, early detection and prevention. What is diabetes? When you ask someone about diabetes, when I ask my patients about what they think, they don't have a straight answer. They say it's more sugar in the blood, but they don't know what it is. So, diabetes is caused by two major factors. First is insulin resistance, second is decreased insulin production. Insulin, what's insulin? It is an hormone created by the pancreas, by the beta cells of the pancreas. So, these cells in the pancreas create the insulin, and this insulin is used to pick up the glucose and give it to the cells. So what is insulin resistance? That means that we do have insulin, but the connection between the insulin and the glucose molecule is not there. What do we mean by decreased insulin production? That means that there is less production of insulin due to various reasons, including decreased production due to infection, due to any injury, due to genetic issues. So basically, decreased insulin production and insulin resistance. This is the major cause of diabetes in the physiological sense. What are the general causes? Most commonly, it is genetic. The other is decreased activity, that is the lifestyle that we are using. And then there are various other reasons that lead us to get diabetes, but in the broader sense is genetic, decreased activity, or other reasons, stress, and all these things. Next, how do we detect? What are the early signs of diabetes? When there is a lot of sugar in your blood vessel, it causes a lot of chemical changes in your body. So what we call as polydipsia, that means there is an increased requirement for drinking water. Patient wants to drink a lot of water. Polyuria, which means the patient will go to the washroom multiple times. The patient will have multiple times in the day. That's okay, that we don't observe generally. But when the patient is going multiple times to the bathroom to pass urine, that is an early sign that you are on the way to get diabetes. Then we have generalized weakness, blurry vision. Blurry vision again is due to the chemical imbalance in between the blood vessels and the presence of the diabetes, the sugar in the blood. And other things like weight loss. Patients will have severe weight loss, sudden weight loss. These are the signs that the patient can see, and then do what? Then the patient has to go meet a qualified physician and get tested. What do you mean by getting tested? There are multiple tests where we can diagnose diabetes. Those are an HbA1c, which is a test which gives an approximate idea about how our sugar levels were in our blood in the last 90 to 120 days. So there is a number in it. So if it is below 6, that means you are in a good position. If it is above 6, from 6 to 6.5, that means you are getting diabetic. You can call yourself pre-diabetic, and anything about 6.5 is purely diabetic. So that is one test. Another test is a fasting blood sugar. A fasting blood sugar is a blood sugar tested after 8 hours of fasting. Generally, patient goes to sleep after dinner and does not take anything after getting up and gets his blood tested. That's a fasting blood sugar. no morning tea, bed tea, no snack or anything before taking that. The 8 hours fasting is a fasting blood sugar. These two are the major screening methods where we can find out whether you have diabetes or not. There are other tests that we can do: fasting insulin levels, postprandial levels, both for insulin and the sugars, and then to find out what kind of status the eyes are in, the kidneys are in. We can do retinopathy and ultrasound, and you can blood test that will tell us the creatinine levels, the EGFRs, and all that. So these are how we can detect the diabetes. What are different types of diabetes that are present in the world? There are multiple types. Multiple types. What we generally discuss with our patients are the three basic categories. That is the diabetes type 1, the diabetes type 2, and the gestational diabetes mellitus. Diabetes type 1 is the one where there is very less insulin, indigenous insulin production. That means the body is not making enough insulin, and these patients are insulin dependent. They will require insulin. Diabetes mellitus type 2 is not insulin dependent, but after a time it might require. But these patients are the ones with the insulin resistance. And the gestational diabetes mellitus is the one where during the pregnancy some mothers get high sugar levels. This could be due to multiple factors, due to the extra living being in her stomach. So this gestational diabetes, generally it goes away after the pregnancy, but the chances of it appearing as a regular diabetes later on in life increases greatly. So what can we do to early detect? A simple thing is to get yearly screening. If you have a family history, if your parents, brothers, sisters, any blood relative, very close blood relative has diabetes mellitus, you screen yourself for diabetes every year. If you have a family history, twice a year. If you do not have a family history, once a year. Just a simple HbA1c and fasting can tell you what situation you are in, whether you are pre-diabetic, diabetic, or non-diabetic. That's the most important thing. The other thing is, if you have a family history or a tendency to have high sugars, that you can do is change your lifestyle modification. We are living in a world of gadgets. What we used to do previously, we are getting things done by sitting with a little phone in hand. So we need to have an active lifestyle. You need to take at least 8 to 10,000 steps per day. Make that a target. We have these devices, they count our steps. Make sure that you walk for 8 to 10,000 steps per day minimum. Next is what we eat. Processed food, that is the biggest and the largest cause of these diet related diabetes mellitus. We eat a lot of processed foods with our burgers and pizzas and all these things. So try to eliminate the processed foods out of your diet. Thirdly, sweets. I like a dessert now and then, that's good. But having high amount of sweet, sugary, all these kind of baked goods regularly, especially in the night, these things will lead to a high tendency to develop diabetes. So your diet is one of the major things in life that you have to control. The processed foods, the sweets, and all that. So once you are in the range, that is from 6 to 6.5, a lot can be done. Once it goes about 6.5, you will need some kind of medical assistance, whether it is a tablet or insulin. 6 to 6.5, you have the control in your hand. You diet, you exercise doesn't mean you have to go to the gym, you have to do heavy weights. Yes, all those things are good, but start off basic. Start off walking twice a day. Start off by walking after meals. Start slow. Start at 10 minutes per day. Then increase it to 15, 20, 30, 40 minutes per day. That's how we will prevent the appearance of the diabetic signs in our lives as early as and push the diabetes to as late as possible. Next, what about the treatment? Treatment has to be done by a qualified doctor. Please do not. We have presently a lot of information in our hand to that we get with our phones, but a qualified doctor is the only one who can see what kind of treatment you should be put on. There are a lot of things online that will say that you can do this, you can do that, you can drink this, you can eat that. No, talk to a qualified doctor, talk to a qualified dietitian for your diet. Once you do that, you will know have enough information in your hand to take further decisions. The latest thing that is going around on the web is diabetes reversal. Is it possible? Yes, it is possible, but it is a very difficult path. If you are diagnosed and your HbA1c is really high, you have to wait. It's going to take time. You have to be strict with your diet. You have to be very good with your lifestyle changes. You have to be very good with your medications. It is not as easy as it is shown on the web. It is not as easy, like 90%, 95% will get converted to diabetes reversal. No, it's not that easy. It is possible, but it's the other way around. Out of 100%, 5 to 10% will reverse the diabetes. The rest will stay on medication, whether it be one tablet, two tablet, three tablets, insulin, or whatever. It all depends on you. These are a few details about diabetes and its early prevention, early detection and prevention. Do we have any questions?